So I'm going to give a very brief insight into some of our work in stakeholder engagement and communications. So the aim of this is to coordinate and increase the reach and engagement of the National Cancer Control Programme information and resources by working in conjunction with a wide range of regional stakeholders, both internal and external to the HSE. We work in partnership with regional HSE communication departments and other key organisations, and we seek to amplify this national messaging at local level and adapt where there is an identified need regionally, such as the Traveller Health Project that Caroline and Anne-Marie referenced earlier. Our role employs multiple communication engagement methods, including but not limited to digital social communications, print and online media, radio, and regionally informed and targeted stakeholder engagement. So just to say some of our key objectives, like we want to raise broad awareness of cancer prevention, early diagnosis messaging among the general public while also targeting specific groups. Like for example, generally in the public, awareness that overweight and obesity and alcohol use increase the risk of cancer. That would be low. We know that people have a high insight that tobacco causes cancer. So we have a lot of work to do in that area. We want to develop a spokespeople for the amplification of key messaging around cancer prevention, early diagnosis. And we will continue to engage with existing health and wellbeing programs. We want to optimize cancer prevention and early diagnosis opportunities, which is really why we're here today about integrating cancer prevention into established health promotion programs. Engage with healthcare professionals to support and inform their work with that cancer prevention and early diagnosis lens. And we'll collaborate with key stakeholders such as local government to inform a systems approach to effective cancer prevention strategies and activities. And we want to deliver or multi-channel communication activities regionally and an annual local communications plan that aligns to NCCP communication priority campaigns to promote the program among internal and external stakeholders. So we're doing all this along a background of just to say that nearly 30% in Ireland of people in Ireland have limited health literacy that can be problematic and inadequate. So people self-report difficulties in accessing, understanding, appraising, and applying information in tasks concerning decision making in healthcare, disease prevention, and health promotion. So this we need to keep this in the background of everything we do. And just to say, from the national strategic context, those three documents we referenced earlier, communication is huge in these, stakeholder awareness, huge public awareness campaigns. This is part of our work. We want people to recognise and act on the symptoms. So these are leading and informing our work also. And just to say as well, some key kind of calendar dates. We work all year round on cancer prevention generally and the five main cancers, but there are key months where other partner organisations be doing work as well, and we try to really increase and cement the messages. And you're hoping that the public will, get it from multiple angles. It really hits home in terms of cancer prevention and early diagnosis, such as the Irish Cancer Prevention Network. So in terms of stakeholder engagement, again, this is both the tip of the iceberg. We've engaged with multiple stakeholders, internal, external to the HSE. There's been some commonalities across our areas, but there's also been very diverse stakeholders and differences in each area as well, which has been very interesting. We're trying to bring a very different lens. If you look here, even Men's Health Week and collaborating in that area, when people think of men's health, they often think testicular cancer. Well, actually, testicular cancer, there's about 169 cases a year in Ireland. Whereas actually, if you think of lung, there's 1,386. So sometimes it's just bringing that lens and that perspective to someone's work. If you look at age friendly, for example, which is it was supporting older people, we're really, looking at how can we optimize the early diagnosis piece here. So look, we've had a very diverse engagement over the past year, and looking forward to this continuing in 2025. Just to give an example of partnership working, we've all worked with county councils locally, really important stakeholder, and a key target action area is outdoor workers in the National Skin Cancer Prevention Plan, hugely at risk of skin cancer. So we worked significantly with lifeguards, outdoor workers such as traffic management, water treatment, all those kind of people who are out in the sun as part of their occupation. So we worked with the county councils in very diverse ways, but really successful, and hoping that the councils now will adopt some of the pieces we've brought in and continue that work and continue that collaboration. In terms of general communication, so we're really trying to extend this reach beyond the walls, the health service, out into communities. So as I said, referenced earlier, multi-channel media. We're at large events to meet people, such as age expos, where you can have the opportunity to engage with hundreds of older people. Um, we have podcasts from the national team that we try to extend locally. We work with healthy clubs, disability organisations. A lot of radio interviews have taken place at regional level this year, so it's been really good, such as in Midwest Radio 96.1 FM. Caroline, who you heard from earlier, would have done a very successful mini podcast series, so little snips of information we're trying to get out into the community, and that's been so successful. It's going to be extended for a second season. So we want to really utilise all these mediums out in the community. Another example, we have a lot of print media that's gone out regionally, and I collaborated with Clare County Council, their Healthy Clare coordinator, to get some, full page and half page ads into their local newspaper, an existing Healthy Clare page, and like that has gone really well. A huge viewer circulation figures in County Clare about sun smart, men's health cancers, sunbed use, breast screening, lung, and subsequent pieces planned for prostate cancer, reduce your risk of cancer as well. So there's a lot of collaboration going on. And just to say as well, there's a lot of very excellent national pieces the national team develops, such as these webinars, and we always, we try to amplify these regionally as well. So I'm going to finish on that slide. Again, a really whistle stop tour just to give a brief insight into the amount of stakeholder engagement and communications, but in a topic like this, where we're trying to get the message out that there are things we can all do to reduce our risk of cancer, and we need early diagnostic cancer. Stakeholder engagement and communications is absolutely core to our work. So thank you.